Hi there, it's Dr. Shah from Shah Aesthetic Surgery, and today's topic is going to be about rhinoplasty recovery. When discussing rhinoplasty recovery with patients, we do like to make sure that patients are optimized from the beginning of the operation, and that starts with the preoperative evaluation. When I evaluate a patient, I want to make sure that they're safe for surgery, so they have to be healthy and they have to be of an age of consent. To get ready for surgery, we have patients stop smoking, stop drinking, stop taking any drugs or nasal medicines that can cause wound healing problems like nasal cocaine or nasal steroids. And we try to get people on to a healthy diet to maximize wound healing, and that would include things like protein shakes, vitamin C supplementation, certain kinds of alternative supplements, and the use of vitamin K. During surgery, to make sure the patients are able to heal as quickly as possible and try and keep recovery as efficient as possible, there are things that we do pay a lot of attention to. Of course, trying to make sure that the patients have really stable blood pressures during surgery to reduce bleeding and reduce swelling are very important. Meticulous attention to detail during surgery helps reduce the risk of later wound healing complications and need for revision surgery. And then finally, I'm very much opposed to excessive bleeding because I know that it can create a lot of problems both in the final product and during surgery. So meticulous attention is paid to hemostasis. I will often, after cleaning out the nose prior to closing it, will flush a little bit of a dilute steroid solution into the tissues so that they don't experience as much swelling in that first week of recovery. And it's worked out very well for my patients, and at this point I've had no complications such as wound healing problems. The postoperative segment of rhinoplasty recovery is frankly the longest. I mean, it will take up to a year for a first-time rhinoplasty patient to see their final results. Now, for revision rhinoplasty patients, it could take much longer than a year because of changes in blood supply and scar tissue burden from previous rhinoplasties. In the initial or first-time rhinoplasty patient, also known as a primary rhinoplasty patient, I like to break down their recovery into three basic phases. Obviously, the day of surgery, they have their operation and they get sent home, usually with a splint on top of the nose and some type of nasal drip pad on the outside. Occasionally, we'll put some packing in the nose, and occasionally, if I do a lot of intranasal breathing reconstruction, I will leave what are called Doyle nasal septal splints. They are silicone rubber splints that hold everything in place on the inside of the nose and allow for the creation of really nice patent airways to allow for good breathing capability. Patients are going to keep their heads a bit elevated for the first week. They're going to ice around the eyes, and they're going to use my postoperative rapid recovery system. After that first week, they come into the office and we remove the external nasal splint that's been molding their skin. If they had an open rhinoplasty, they have sutures that need to be removed, and those are removed by myself. And if it's time to remove intranasal splinting, we will remove intranasal splints at that time. For the next 2 months, I have patients using nighttime soft tissue taping techniques and 3 times a day soft tissue massage using tongue depressors. We allow them to sleep with nasal humidifiers and use nasal toilet or saline washing of the nose to make sure things stay clean. Patients are going to be congested for up to 3 months after surgery in most cases, especially if intranasal work has been done. The upper 2/3 of the nose will settle down typically in that first 2 to 3 months. And if the patient has had some type of nasal fracture, also known as an osteotomy, to narrow the nasal bones, it'll be between 2 and 3 months before those nasal bones are solidified enough. So I have patients on activity restriction in that first couple of months because I don't want you getting hit in the nose and repositioning the freshly broken nose bones. Usually after the first 3 months, I have the patients stop their nasal taping and stop the massage, as it really doesn't make any changes at that point. The only thing we'll do to try and enhance recovery is take a look at the nose and see if there's been a lot of extra swelling in the nose, primarily in the nasal tip. In those situations, we'll sometimes offer nasal tip steroid injections of what they call a dilute Kenalog solution. And what that does is it helps decrease some of the scar in the nasal tip, improve the drainage of lymph in the nasal tip, and decongest it a little bit. After that first 3 months, a lot of patients will not really see any major changes for the next 6 months. And that just means that the nose is getting ready for its final push. As I said before, it takes up to a year for a nose to fully heal. And so it's usually during months 10, 11, and 12 that the last part of the nose, the nasal tip and nasal base, finalize their healing. Patients really, for that first 9 months, complain about the nose being stiff and not moving normally, or stiffness in the upper lip. All that stuff starts to go away when the swelling comes out of the nasal tip and the nasal base. After 1 year, you can say basically now you're at the first day of your new nose. And it's at that point that we evaluate patients for any touch-ups or additional work that might need to be done.